everyone. Welcome to VetSOAP, an educational podcast focused on veterinarians, vet techs, and other animal health members. We're going to help you uncover the people and techniques used by your colleagues to remove the challenges of managing your practice. Why? So you can uncover more opportunities, spend more time on the things that you enjoy, and ultimately earn the money you deserve. This is a production of Viticus Group and is recorded here in sunny Las Vegas. Our website is viticuspodcast.com, and an audio and video version of this episode is available at all of your favorite podcast and video distribution platforms. All right, let me introduce to you guys our guest for today. I'm very excited about this. Her title, I think, is up for negotiations. She says that she's known as the diva. I'm thinking it's the queen because that's how I've always heard anybody introduce Miss Mary Berg to me is she is the dental queen. So, Mary, how are you doing today?
I am doing wonderful. Thank you for having me today. Appreciate it.
And so it's diva. That is what we're sticking
It's
with.
diva. Yes, it's the
I think
dental
we need to
diva.
challenge
Okay.
it. I think the tiara is probably still just as big, right?
Yeah, it's still here. It's just, a small little one. I'm very modest about it.
Yeah, no, understandable. I appreciate it. The humility. Thank you.
There you go. Yeah.
Oh, well, thanks so much for joining us. I just have a couple questions I wanted to go through with you today. I want to talk about a couple things. I also want to get ahead of the dental month, I know, which is is it January, February is our dental month?
February.
February. Yeah, so I want to get
Yes.
ahead of that, make sure everybody understands the importance of our oral health and what it is that we can
Right.
do as veterinary professionals. So, Miss Berry, do you mind telling me a little bit about your background and really what was the moment that you decided to get into dentistry?
Well, actually, I grew up on a farm. I always wanted to be a veterinarian, but kind of followed a different path and met my husband, who's military, and I traveled around the world with him. However, we moved to Lawrence, Kansas in a long, long time ago, and I applied at the university for microbiology, which was my undergrad degree. And long story short, I applied. They didn't hire me, but they recommended I apply with a small research company who did companion animal dental research. And that's kind of where it all started. And I
Wow.
worked in research for 13 years and then private practice for 7. And I've been doing educating and training independently for the last 10 years.
Oh, that's great. That sounds wonderful. You've done a little bit in so many different fields. That's so well rounded. I think that's fantastic. I don't know how I would. I don't know if I'm one for research, but definitely for general practice and specialty, I enjoy that. So
Yeah.
not so much dentistry. The sound of the teeth
Oh, come
I
on
can do
now.
without.
I feel that way about eyes, so I get you. Yeah.
So I'm sure that you've seen many advancements that have come and gone, throughout the industry. What would you say would be like your top 2 things that have really made a difference in the veterinary industry?
Well, I think honestly, the amount of practices that now have intraoral radiology in their practice
Oh, that's
is
huge.
phenomenal because it is such a diagnostic tool. I can't even imagine doing a dental procedure anymore without having those radiographs to tell me what's going on below the gum line. And I know this isn't probably in every practice because it's kind of a specialty level, but the CT scanners and the MRIs that they're being able to do on dogs' oral cavities to really hone down the amount of bone loss or pathology that's present is really very, very cool, but also a little creepy, but really, really cool.
Oh, that's awesome. Yeah, there's been quite a bit of changes. I remember back in the day using halothane for your anesthesia machines,
Oh,
right?
yes.
Now
That,
it's
and I
so
guess I should add
different.
nerve blocks to that, and pain management is so much better than it was even 5, 10 years
Oh,
ago. So,
most definitely.
yeah.
Yes, you got to love those regional nerve blocks.
Yes,
All
yes.
right. So we kind of touched a little bit on your title. How did you end up earning that? I mean, was there a dance off? Was there some type of a contest of some sort? Like, how did you
No.
finally get this diva title? I need to
Well,
know these
actually,
things.
this happened at the Western Vet Conference at WVC. I don't even know, probably 10, 12, 15 years ago, something like that. It's been a while. I was speaking, and the young lady who introduced me as my moderator lost my bio. And she gets up in front of all of the technicians that were in the lecture and she goes, "Well, this is Mary Berg. She's like the dental diva." And I said, "Oh my God, I'm keeping that."
That's
So I
awesome.
have since embraced that. So that's how I got the titles.
That's great. Well, I hope one day I get a cool story like that and a title to go with it.
Oh, I'm sure we can come up with one for you.
I just got to lose a bio. So I'm
There you
sure that
go.
you've seen many patients in all your years, and I'm sure some cases have
Yes.
probably really, you not only touched your heart, but have probably made a file in that storage of brain of yours. Could you tell me about your most memorable patient and maybe an unexpected positive outcome?
Well, I think one of the patients that stands out to me was a Chihuahua who we had seen at our practice probably, off and on for 5 or 6 years, and we did dental procedures on him every year. And he was your typical Chihuahua. Didn't want anybody to hold him. He was kind of, a little grumpy. And we finally had a very serious discussion with the pet owner and explained that he's probably going to be better if we just removed all of his teeth. And she was a little hesitant at first, but we went ahead and did that. And on his follow-up appointment 2 weeks after those extractions, she came in tears into the treatment room with me. And I was kind of nervous at first, like, oh gosh, why is she crying? But
Mhm.
she was actually so ecstatic that after we did that procedure, was the first time little Scooter let anybody else in his family hold him.
Wow.
So it made such a big difference to me that we finally got rid of all of his oral pain and he wasn't hurting anymore. So he was just as happy as a clam to have anybody play with him. And that really, really still struck home with me. I actually kind of ran into his owner a few years after I left the practice, and she saw me and recognized me and just came up and thanked me again for kind of convincing her that that was going to be the best thing for that little guy's life. So that's one of the
Wow.
cases that really stands out to me.
That's such a great story. My mom had a small dog who had dental disease, but he
Mhm.
lost his both canine teeth, and so his tongue would just hang to the side.
Yeah, hangs out all the
And
time, yeah.
it does. It adds so much to the character.
Yeah. I think one other story is I had a man come in with his dog who he had adopted from a rescue, and it was a Maltese, and, had severe dental disease. This dog was only 3 or 4 years old, and, we had, I don't even remember right now how many teeth we removed, but somewhere in the teens. We'll just kinda leave it at
Wow.
that. And on the follow-up, this gentleman comes into me, and he's, like, dead serious to me, and he looks at me, he goes, "Can you put them back?" And I kinda looked at him, and like, "Well, we don't have any returns on, extracted teeth, sorry." And he goes, "Well, really, I'm joking." He says, "But I thought I had adopted this super calm, quiet dog, and now I have this little fireball." And I'm like, "That's kinda what you're supposed to have." So, I mean, he was really joking with me, but it was just kind of a impression of like, "Well, can you put him back? Because I don't know if I can handle this." But
Yeah.
it did make a big difference in how well that dog felt after we got rid of all that infected teeth in his mouth.
Um, Nobody likes a toothache.
Nobody likes it. Nobody likes the feeling you are when you're constantly bombarded by bacteria in the rest of your body too, because it can affect your
Yes.
systemic, your kidney, liver, and heart too. So,
Yes. Everything is just, it's all
mhm,
connected.
it's all
So you get
connected.
to go into many clinics and you do training all over the
Yes,
United States. I'm sure you would probably train internationally given the
I
opportunity.
I have done Canada, but
Ooh,
yeah,
look
I
at
would
that.
love to go to. I'd love to go to like I'm just throwing out there Australia if anybody needs training down there. But no, I do. Have gone into Canada to do some training as well as speaking at conferences in Canada. So and all over the United States.
So do you have like a Rolodex, maybe a couple quick advice tips that you would give to the veterinary grad to help launch their career in the dentistry world? Anything that is a must have or you must do or you really have to see?
Well, I think it's really important, and it's getting better, but we still don't get a whole lot of education on dentistry in veterinary technology or nursing programs. And even in veterinary schools, they're getting more education than they used to. But I would just encourage them to get as much dental education as you can. If you think about it, that over 80% of the clients that you see, or 8 out of every 10 dogs, or even 8 out of 10 cats that come into your practice have some degree of periodontal disease. And it's totally preventative, or preventative if we treat it early. And let's not wait till we're doing 17 extractions. Let's get those patients in on an annual basis and to keep their mouth healthy, just like what we do when we go to the dentist every 6 months. We're trying to make sure we keep that patient as healthy as long as possible, because I know everybody'd love to spend a couple more years with your pet. I know I want to, and if we can keep their mouth healthy, we have a much better chance of adding those extra years.
Yeah. So, Mary, be honest with me. Do you brush your dog's teeth?
Oh God, I knew you'd ask me that. I'm going to be 110% honest and say, no, I do not. I am not home, and my husband doesn't. I
I'm
do,
sure it's probably done
however.
periodically.
Yeah, well, I do feed her a dental diet. That's her complete diet. And then she does get a dental chew every single day, which if she does not get, she lets us know that the dental treat has been forgotten. And she has been known to try to play one of us off each other to say that, well, Dad didn't give it to me, so you must. So we have to have a communication basis going so that she doesn't get too many of them. But she had her first dental cleaning about 2 months ago. So, and she's 3 years old. She's maybe four now. She's a little Jack Russell mix, and she had her first cleaning the other day, or a couple months ago, and she's doing great. So,
Jack Russells have great teeth.
yes, they do.
So, how are we to contact you? If there's a clinic out there who would like to do some continued education with you, I see that on your website you've got some tips and tricks. How can we get a hold of
Yes.
you, Miss Berg?
You can go ahead and contact me through the website if you like, or you can email me at mlberg@btcveted.com.
That is great. Thank you so much for your time today. If you have a
Thanks for
question,
having me.
comment, or suggestion for an episode, please email us at vetsoap@vitiguspodcast.com. That's vetsoap@vitiguspodcast.com. If you like what we're doing, please leave a positive review on your favorite platform. And thanks for watching.